Genetic counseling. Genetic counseling is a specialized field of healthcare that involves providing individuals and families with information and support related to genetic conditions and their potential implications. Genetic counselors are trained professionals who help people understand the genetic aspects of their health and make informed decisions about testing, treatment, and family planning. Here are some key points about genetic counseling. Scope of practice. Genetic counselors work with individuals and families who may be at risk for inherited conditions, birth defects, or genetic disorders. They may assist clients who are already affected by a genetic condition or those who have a family history of such conditions. Education and training. Genetic counselors typically have a master's degree in genetic counseling from an accredited program. Their training includes coursework in medical genetics, counseling techniques, ethics, and communication skills. They also undergo clinical rotations to gain practical experience. Services provided. Genetic counselors offer a range of services, including risk assessment, assessing the likelihood of a genetic condition based on family history, medical records, and other relevant information. Education, providing information about genetic conditions, inheritance patterns, and available testing options. Genetic testing, recommending and coordinating genetic tests to diagnose or predict genetic conditions. Interpretation, explaining the results of genetic tests and their implications for the individual and their family. Psychosocial support, addressing emotional and psychological aspects of genetic conditions, helping clients cope with diagnosis and decision-making. Family planning, assisting individuals and couples in making informed decisions about reproduction, including options like prenatal testing, preimplantation genetic diagnosis, PGD, and adoption. Ethical considerations, discussing ethical dilemmas related to genetic testing, privacy, and potential implications of test results. Coordination of care, collaborating with healthcare providers, researchers, and other professionals to ensure comprehensive care for individuals with genetic conditions. Settings. Genetic counselors work in a variety of healthcare settings, including hospitals, clinics, research institutions, and private practices. They often collaborate with medical geneticists, obstetricians, pediatricians, oncologists, and other specialists. Confidentiality. Genetic counselors prioritize patient confidentiality, especially given the sensitive nature of genetic information. Multidisciplinary approach. Genetic counseling often involves a multidisciplinary team approach to address the complex medical, psychological, and ethical aspects of genetic conditions. Evolution of genetic counseling. Genetic counseling has evolved over the years due to advances in genetic research and technology. Genetic counselors now deal with a wide range of conditions, from rare genetic disorders to more common conditions influenced by multiple genes. If you're seeking genetic counseling services or more up-to-date information, it's recommended to consult with a qualified healthcare professional or genetic counselor.